have how to accommodate the loss created, the created, to go to sleep and not get any benefit from losing their loved ones? These are big questions we need to answer.
Truly. Now, some people have said that they do not think that it is right for medical personnel, doctors, to go on strike because of the Hippocratic Oath. A person who's in a position...
The Hippocratic Oath have been reviewed all over the world by the World Health Organization. And it states that the physician should also take care of himself. A physician that is hungry and is not able to feed is not in the state of good health. Because good health means both mentally, physically, financially, and psychologically. Psychologically and mentally, when you're not fit for 4 months, when you are hungry, you can't afford to pay your rent, you cannot afford to pay your school fees, you cannot afford to even transport yourself to school. When you are now begging for alms for people, from parents, for people around, from patients, in trying to even survive, you not expect people to go and treat school. We are human beings, we are not superhuman.
Surely.
And we live in this environment that you go to market, go to the shops, go to places to acquire that is the basic necessities of life. And no landlord will want to tell you that, oh, we have not been paid, and they'll allow you to pay and don't pay your rent. No school will tell you that your children will be sent home from school when you are not able to pay their school fees. Those are basic things we need. And basic things have to be provided for their citizens.
All right. Now, consultants and nurses have been offering skeletal services. They are obviously overwhelmed. There are countless reports of that situation. Have had any communication from the consultants? Have they spoken to you?
Yes, I've had a call from the Medical Dental Council Consultants of Nigeria, who tells us that he's in support of us.
Oh.
And they know that we fight for them. And other health workers can also put to bear that the fight is not just for us. The fight is for better infrastructures in the hospitals. The fight is for better health welfare packages for all health workers. The fight is for that needs to be in the hospitals. Good function.
An opportunity to practice outside Nigeria. Would you take it if this situation persists?
Nice question. I've been labored with this question because I have parents that have one or two health challenges, and I tend to wonder if we all run away from Nigeria, who now takes care of them? They have lived and sacrificed so much for me to trade as a specialist, and I run for greener pastures. So who will they run to when they fall ill? That is why most of us have been patriotic in trying to pay our own quota to the system, and we hope the government does their own. Yes, I see better security outside. Yes, I see better insurance outside. Yes, I see better welfare packages outside. But who takes care of a more emotional and asthmatic attack and has to go to the hospital? Those are what have kept us in Nigeria. Those are why we're asking for better health care.
All right. Now, right here in Nigeria, how would you describe the disparity of the welfare of doctors in the public and private sectors of healthcare?
What's very good was private healthcare that have been doing well. I don't want to make any comments that I don't do an advert for them. The minister said some time back that the residents in the United Kingdom and United States are made to pay for the residents while we have been fed here. But let me ask a big question: how much is a doctor, nurse, lab scientist, and paid in the U.S.? In the UK, as it stands, they are paid between $15,000 and pounds to about £30,000. If you go work on a rural area, you are paid an extra £10,000, and you get all insurance and every package you ask for. Here, money annually ranges from between 2 million to 3 million naira. So where do you think a doctor wants to go? That's what accounts for most of the brain drain. Nobody wants to stay in a country where they don't have health insurance. Nobody wants to stay in the country where they are paid 5,000 naira as an allowance. Nobody wants to stay in a country where doctors are being kidnapped regularly in Port Harcourt, in most of the south country. Nobody wants to stay in a country where you can't predict when your next salary comes. So private and state, all our hospitals there may be some discrepancy between those in training and those not in training. Those in training are expected to get more salary because they are being a specialist. And we enjoy everybody to try and specialize so that every Nigerian can get the best health care.
Surely. Now, a meeting is supposed to happen tomorrow. It's supposed to resume after the Easter holiday. What are your expectations for that meeting?
You'll be right for that meeting.
You haven't?
No, I have not.
No meeting?
But because of the Honorable Speaker of the House, Honorable Bajamila, that will be on Thursday, 8th of April. That is sure. But for the one, the Minister of Labour said there have not been any invite to us of any form.
Chat station, all for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station. All for you on 92.3 Nigeria Info. We crossfire in the morning. Crossfire in the morning. Get into the midday dialogue and tell you about the hard facts, and then let's talk into the chat station.
The Accountant General's office what to do. Not all institutions are involved. Try to see.
So he's going around telling everybody that we've signed an MOU. We signed an MOU to go do a meeting with our own people. And we had a meeting yesterday around 6:30 p.m. and we decided that